What's good, guys? Welcome back to my YouTube channel, and welcome to anyone that is new on here. Please do hit the subscribe button to be part of the Nestle channel. And yeah, guys, lately, since we had a crisis in the country, I've been so lazy to film videos. I've been wanting to film this video since Monday, if I'm not mistaken, or Tuesday. But the whole of this week I've been saying I want to film, but I would end up not filming. Anyways, we are here now, so let's not make the intro super duper long. What are we talking about today? So we are going to talk about medical eligibility criteria for contraceptives. So I do have a video on my channel about the types of contraceptives that we have in the public sector. So if you haven't checked it out, please do. So basically, I'm going to be using this wheel. I'm definitely sure that healthcare providers do know what this wheel is. This wheel was developed by a World Health Organization, aka WHO. It was developed in 2015. So it's like a guideline. Yeah, it's like a guideline in terms of advising a client on which contraceptive they should use if they are having certain medical conditions. Okay, let's start with the simplest condition that we get to have as women, and it's headache. I was looking at this in the morning. Okay, yeah, there we go. So here it says headache, non-migrainous, meaning it's headache that is not migraine. These headaches can be caused by various things. For me personally, whenever I get a headache, I know that it means I am not drinking enough water. So that headache, it's not migrainous. What do they mean? One means use the method in any circumstance, meaning if you have that, like if you have those non-migrainous headaches, you can use that contraceptive method. And then we have two, it says generally use the method. And then we have three, it says use of the method not usually recommended unless others or more appropriate methods are not available or acceptable. So number three means it's not advisable for you to use the contraceptive, but if you do not have other options, then you can still use it. And then number four means a method not to be used. So yeah, it means don't use. It doesn't matter if there are no contraceptives to use, but do not use. So I'm obviously not going to do all these conditions, but I'm going to do the most common ones, the ones that I know a lot of people do go through. So in terms of having those headaches that are not migrainous, you can use all these contraceptive methods that are here, which are your combined hormonal contraceptives, progesterone only pills, we have progesterone only injectables, we have implants. Please guys, go and watch that video that I made last year, because it will make you understand what am I talking about when I'm referring to implants, when I'm referring to IUCD. And we have levonorgestrel IUCD, and we also have copper IUCD. Let's go back to headache non-migrainous. If you're having those headaches that are non-migrainous, you can use all these contraceptive methods and they won't have any negative effect on you. I'm not saying they won't have side effects, but I'm saying they won't have negative effects on you. You won't find yourself hospitalized because of a contraceptive. In terms of migraines, make sure that you do not use the combined hormonal contraceptive, guys. It's a 4, meaning method not to be used. But the good one to use when you are having migraines, if you are a person of headache, you can use the copper IUD. We have antiretroviral therapy, which is your ARVs. And I think this I need to get into. What exactly are we supposed to take when we are HIV positive? The most favorable ones are combined hormonal contraceptives. It has a 1 or 2, which is use the method in any circumstances, or generally use the method. Hormonal IUCD and the copper IUCD. It says use of the method not usually recommended unless other or more appropriate methods are not available or acceptable. So basically, if you are on antiretroviral therapy, it's not advisable for you to use the IUCD, both of them, unless there is nothing else available for you to use. We are now on HIV WHO clinical staging. and this is stage 3 and 4. You can use the combined hormonal therapy. Basically, all those family planning methods are actually good for you, except for both the IUCD as well, because it's a 3, and it says the use of the method not usually recommended unless other more or appropriate methods are not available or acceptable. In terms of sexual transmitted infection such as gonorrhea and chlamydia, you can use your combined hormonal contraceptives. You can use your progesterone only pills, you can use your progesterone only injectables, you can use your Implanol. But in terms of IUCD, and both IUCDs, in fact the copper one and the LNG one, not use it. So it's very important for you to know your conditions, especially your sexual reproductive system conditions, before you can get into any type of contraceptive.
So it means testing for STIs before.
Testing for STIs before you use long-acting such as IUCD, because guys, it's not recommended. How many people do test for STIs? People don't even test for STIs. So you need to, if you're considering to use IUCD, you need to go and test yourself for STIs such as gonorrhea as well as chlamydia, because you are not supposed to use IUCD at all during that period. So you'll find people saying, oh, IUCD is dangerous. IUCD, it's not dangerous, but it is dangerous when you put it in medical conditions such as chlamydia and gonorrhea. In terms of the increased risk of STIs, you can use from combined hormonal contraceptive to Implanol. IUCD, there are so many terms and conditions for IUCD. Hey, people must not just throw it inside their wombs without doing proper medical examination and checkup. Yeah. In terms of IUCD, you can generally use it, but also it is not recommended unless there are no other appropriate methods for you to use. Okay. PID is pelvic inflammatory diseases, but it's an infection of the layer of the pelvic area. So if you have pelvic inflammatory diseases and current, not previous, if you've been diagnosed currently, you cannot use the 2 IUCD at all, guys. You can use all the methods that are there, your implants and all that. And yeah, it's a device that you put inside your uterus. And where is your uterus? Your uterus is in the pelvic area. And now it means your pelvic area has infection, right? So if you're gonna introduce something else again, it might aggravate that infection. All right, guys, in terms of the postpartum and breastfeeding, I know a lot of people would like to hear about this. If you gave birth less than two days ago, the best method for you to use is IUCD, but the copper one, okay? You see? It's the method that is good for you to use if you just gave birth now. And if you just gave birth now, you cannot use the combined hormonal contraceptive. It's not allowed, you guys. Progesterone only injectables is actually use of the method not usually recommended unless others or more appropriate methods are not available. So you can't give a petogen to a woman that just gave birth 48 hours before. Osmaki is shaking her head, and I know why she's doing that. You can't give depo immediately after birth. You have to wait for what? Let's see. You gotta wait for 6 weeks, baby. Yeah. In terms of 48 hours and in 4 weeks, they're still saying combined hormonal contraceptives cannot be used completely. You can't take combined hormonal contraceptives. When we are talking on combined hormonal contraceptives, we're also talking about patch. People love patch. You love patch. There is also something that is called a ring. There are also other injectables that are hormonal combined, and there's also a pill for that. So it cannot be used at 48 hours to 4 weeks of post-delivery or breastfeeding. And then in terms of progesterone only pills, you can generally use it. Progesterone only injectables, depo, again at 4 weeks you cannot use it unless there's nothing else to use. Then that's when you can give depo. Implanol, you can generally use Implanol at 48 hours after giving birth to 4 weeks. You can give implant. And IUCD, It's also not advisable, but you can give it if there's nothing else to use. So let's go to 4 weeks up to 6 weeks. Combined hormonal contraceptives, your patch, your ring, and other pills, you cannot give them at 4 weeks up to 6 weeks. You can't give them. And progesterone only tablets you can generally give. Progesterone only injections you are not allowed to give unless there is nothing else to give. Implanol you can generally give. What's good to give at 6 weeks? It's definitely both the IUCDs, the copper one and the hormonal one. And at 6 weeks up to 6 months, in terms of combined hormonal contraceptives, your patch, your ring. So basically a patch and ring and that group, it's not, I don't think it's good for breastfeeding women, because here they are saying at 6 weeks to 6 months, it's not recommendable for you to use those types of contraceptive methods, and then the rest you can use. So guys, you won't believe what happened while I was at work filming my video. My battery died. So a lot of the things that I mentioned on during the time I thought I was recording when I was not, I'm just gonna run through them just so that I don't make the video super duper long. I think on the last part of that video that I filmed at work, I spoke about let me see, I think I spoke about 6 weeks to 6 months. So at 6 weeks to 6 months, as I said, the patch, the ring, the injectables that have the combined hormonal contraceptives, it's totally not recommended to be used, but can be used if you don't have anything else to use. And then the rest of the contraceptive methods that are there, your progesterone only pills, your progesterone only injectables, Implanol, and both IUCDs, they are actually recommended to be used. I'm honestly gonna run through everything in terms of adolescents, those who are younger than 18 years old. You guys know that I am an adolescent and youth friendly nurse and an advocate for the adolescents and youth that are living with HIV and those who are not HIV positive. So if you are an adolescent less than 18 years old, you can actually use your patch, your ring, which are your combined hormonal contraceptives. You can also use your progesterone only pills. In terms of progesterone only injectables, you can generally use them, but they got a 2 instead of getting a 1. So you can give a depot to a kid that is below 18. You can generally give it to them. And implants, definitely use implants, you young ones. And in terms of IUCD, both the hormonal IUCD as well as the copper one, you can generally use it. And we will quickly move to vaginal bleeding. A lot of women complain of unexplained vaginal bleeding, and they're actually mentioning it here, that is unexplained vaginal bleeding. And in terms of unexplained vaginal bleeding, what's good to use? You can generally use your patch, your ring, your injectables, those ones that have combined hormonal contraceptives. However, you cannot use IUCD. So if you are having unexplained vaginal bleeding, do not go for IUCD. In terms of uterine fibroids, I know women also do have challenges with uterine fibroids. Uterine fibroids, actually, you can use all these methods that I mentioned here. You see that everything got a 1, so it means you can use the method in any circumstances, so it's not a big deal. I'm gonna run through and skip cervical neoplasia. I'm also going to skip through cervical cancer. In terms of cervical cancer, they're talking about pre-treatment, so I'm gonna skip that. And then in terms of breast cancer, guys, current breast cancer, so if you're currently having breast cancer, you are not supposed to be using any contraceptives that is hormonal. What is recommended is the IUCD, the copper one, simply because it doesn't have any hormones. So everything else, it's a no-no, you must not use it. So if you get diagnosed with breast cancer, the best thing to do is to literally stop using any contraceptive and get into the IUCD. And I'm also gonna pass through liver disease. I'm also gonna skip through venous thromboembolism, major surgery, blah blah blah. I'm gonna skip through that. And we have cardiac, we have cardiovascular diseases. We have stroke, ischemic heart diseases. We have multiple risk factors. Guys, I want to show you something about the combined hormonal contraceptives, right? These are the combined, okay, I'm trying to see. These are the combined, you see, these are the combined hormonal contraceptives, right? And it's your pill, it's your patch, it's your ring, it's your injectable. You see all that group. Most of them, they are not recommended to be used in terms of people that are having pre-existing conditions. So what I've realized since I've been going through this wheel is that out of all these that are here, the number one contraceptive that is forbidden in most of these conditions that are here, it's actually the combined hormonal contraceptive. And I know that a lot of women actually love it. A lot of women love using a patch. Ooh, patch this, patch that, ring this, ring that. And I'm now wondering if people do really have this information. They need to consider their medical health and before they can choose or start using these combined hormonal contraceptives. I really wonder. So please do share this video with people that you think they might find it useful. So if you've had stroke, or if you have stroke, you're not supposed to use those contraceptives. And the number one contraceptive that you can use for you is definitely Copper IUCD, as well as the hormonal one. And you can also have your implant as well as progesterone only pills. In terms of progesterone injection, it is not recommended unless there's nothing else to use. And we're gonna skip ischemic heart diseases, we're gonna skip multiple risk factors. But on multiple risk factors, I think it's similar as this, what do you call it, as the stroke one. In terms of hypertension, I know a lot of women do suffer from hypertension. And in terms of hypertension, what method is friendly to use? It's definitely progesterone only pills, Implanol, and both the IUCD. And what is not recommended but you can use if you don't have anything else to use, it's definitely the combined hormonal contraceptives. So you see, it's not recommended even here on women who have hypertension that is ranging from a systolic of 140 to 159 and a diastolic of 90 to a 99, or adequately controlled. You are not advised to use patch, ring, pill, and injectables that are combined hormonal contraceptives. But if there is nothing else that you can use, then you can definitely go for it. And in terms of hypertension that has a systolic of 160 and a diastolic of 100, you're not supposed to use the combined hormonal contraceptive at all. Your patch and everything else, you're not supposed to use them. What's good for you is definitely Copper IUCD, and you can generally use levonorgestrel as well as implant and progesterone only pills. In terms of progesterone only injectables, you can use them if there is nothing else to use. I'm not going to talk about obesity. I'm not going to talk about diabetes. I'm also not going to talk about smoking. But in terms of smoking, the combined hormonal contraceptives, you can generally use it. And then the rest of the contraceptives, definitely a thumbs up, you can use them. And that is if you are less than 35 years old and you are smoking. And if you are smoking and you are older than 35 years old, the combined hormonal contraceptives, it's not recommended, but you can use if you have nothing else to use. And the rest of the contraceptives, you can use them number one. So yeah, guys, that was the remaining information that I could not share when I was at work. I actually did check. If you guys could have seen me talking, and then only to find out before but yeah, thank you guys for watching, and please do hit the subscribe button to be part of the NSC channel. And anyone that is new, don't leave the channel without subscribing, and share the video to people that might find it informative. Guys, I feel like as women, we are not well educated in terms of selecting the best contraceptive method that are suitable for us. Sometimes we find ourselves having to deal with life-threatening situations due to contraceptives, simply because we did not pick our contraceptives according to what's suitable for us in terms of our health. Yeah, give the video a thumbs up. Now let me go and finish up my hair because I was doing the lock method before I sleep. Bye guys.